The fellowship program really was something that I thought prepared me for real-world practice.
So infectious diseases is one of the first fellowships that SIU had. We've graduated about 25 fellows, all placed very well in different parts of the country as well as different parts of the world. So we're not a very big program. We typically take one fellow per year and sometimes two fellows per year. That just allows a lot of one-on-one time with the attendings.
Because it's a smaller program, we have a collegial and a friendly environment. We have good diversity, I would say.
A lot of them, they're my family now, and that's really what's made me stick around. I've experienced nothing but support from all of the faculty.
We get to follow them as they progress from being trainees to being independent physicians. And we take pride in preparing our fellows to being independent infectious disease specialists. Whether it's a clinical pathway or education pathway, we will do our best to make you a leader in that field.
The culture here is one of the best strengths of SIU, that everyone's been very supportive. And again, when I say that it's a conducive environment for learning, I don't kid at all. It's 100% true.
We are situated in the southern central part of Illinois as a tertiary care center in between two big centers in St. Louis and Chicago. So we get a fair share of diverse pathology that the fellows are exposed to.
Very busy service among the two hospitals that we cover. We get referrals from different smaller counties, and that makes the exposure even bigger.
When I was a resident, I lived one song away from the hospital. When I was a fellow, I lived 2 songs away from the hospital. Now that I'm an attending and have a kid, I live 2.5 songs away from the hospital. If you wanted to say chart check from home and then round, you can do that. Round, see your patients, go home, do your notes, make sure orders are in, and then have a life.
Work-life balance is important for you as a fellow and for our patients as well. That gives better quality care for the patients, better safety for the patient, but also that helps you be your better self to do your best and put all that you can in the work that you do, whether that's patient care, whether that's research or scholarly.
So many of our fellows stayed back on faculty because they love the teams. Springfield is a nice city to raise children in. A lot of people with dual physician families, very easy because we're not stuck in traffic. The cost of living is reasonable, and it's just a nice and friendly place in the Midwest. There's a lot of fulfillment practicing medicine here. We really look for people who are curious, with a great growth mindset, willing to ask questions, and people who are willing to learn.
Be teachable, be a good human being. Don't forget what it's like to be a patient yourself. Be very open to constructive criticism, and just have an open mind. Really, with infectious diseases, we see a lot of weird stuff. If you think it's weird, there's something weirder that's going to happen. So just be open to anything. If you want to do something, Dr. Sundaration can make it happen. You'll have all the support and most of the resources that you will need to do that. For any fellow, whatever avenue you choose to take your career to, there's ID doctors that are researchers, there are ID doctors who do a lot of advocacy and public health work. There are ID doctors who just want to focus on just clinical, medical work. All of those you can be trained very well for here in SIU.